Wow. My goodness. Wow, 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 wow. Hello, Christopher. Hello, soul sister. Nice to see you. Nice to see you. Good evening. How was your day? Hi, soul sister. My song is not as hot as yours. Hi, Bukran. Good to see you. Hello, Danny David. Please tell me where you're watching me from. I hope you're enjoying Speak for Gold. Tell me where you're watching me from. Good to see you. Hello. Yeah, soul sister. I'm coming to eat that moi moi. Oh, hi. I should come to Canada soon. Wow, Ukraine. Good to see you. So how was your Speak for Gold day if you're coming to Speak for Gold? How was it? Hello. Hi, Tonya. Good to see you. How was your day? It's been snowing in England. Hello, Brother Lulu. Good to see you. Hi, Coach by Tobe. I love your book. Coach Tobe, I like your book. I love your book. Wow, wow, wow. Wow. So good evening, everyone. You know, I thought I should, I'm going to start off. You know, I thought I should just talk about eyes tonight. You know, that's my passion. But I'll first of all introduce myself. And if at some point you want to join me, I'm happy to let you on board. My name is Dr. Chi, and I am Chi Vision. My passion is about vision. I change perspective of people's eyes, both physically and spiritually. So tonight I felt after listening to Naomi, I thought I should talk about eyes. How many people got eyes? How many people have eyes? I want us to interact. If you have eyes, let me know. I know it's a very difficult question to ask, isn't it? I want to see your comments. If you have eyes, let me know. Wow. Okay. Initially, probably will be boring. I'm going to talk about eyes, and I'm going to say that eyes, everybody's got eyes. Animals got eyes. But for humans, there are two eyes. Wow, you got two eyes. But believe it or not everybody have healthy eyes. So I'm going to talk about definition of eyes and what makes it healthy. Hey, my coach, play Mecca, fire Mecca. We're talking about eyes tonight. I want to talk about eyes. I want to talk about vision. So I said, healthy eyes is when your two organs in front of your head is positioned in the front so you can see. So when your two eyes are focusing properly, they are healthy, they've got good visual effect, good vision, no vision defect, and I'll explain all that. No high pressure of your eyes, I will explain all that. Then you can say you've got healthy eyes. I'll say it again. Healthy eyes when you have healthy, working, focusing eyes that are not diseased. Eyes that are not diseased, that focus properly without visual field defect. That's healthy eyes. And when your eyes are healthy, you wonder, what do I mean by focusing? I don't know if you've ever seen people when they are looking, they are squinting, they are trying to reduce how much they can see. The reason they are doing that is because they can either be short-sighted or long-sighted. Have you ever heard such word? Tell me if you've heard short-sighted and long-sighted. Who knows what short-sighted is and who knows what long-sighted is? If you know, please make your comments. I want to see your comments. Have you heard about being short-sighted or being long-sighted? Okay. Unique Omadadi says, yes, she's heard about being short-sighted and being long-sighted. Yes, Danny says he knows as well. Yes, oh wow, Tonya is short-sighted. Remind me, I will explain that. But you see, focusing problem is when you're either short-sighted, long-sighted, and you can have rugby-shaped eyeballs. When you are short-sighted, it means your images are not focusing on the retina. What is the retina? The retina is the photographic plate of the eye, where all the images fall. You know, every camera has a plate. When the image don't fall on the plate, you don't see well. So when you're not focusing properly, you're either short or long. When you're long-sighted, the images are falling behind the retina, longer than the retina. That's where the word comes. Short, in front of the retina, long, behind the retina. And when you've got rugby-shaped eyeball, you've got images are falling on two sides. Hi, Billy. So we're talking about being short-sighted, being long-sighted, and having rugby-shaped eyeball. Remember, my definition is healthy eyes that focus properly and does not have visual field defects. But what about the disease? I talked about eye disease. Eye disease can be many. If you typically look at my eyes, for instance, see my eyes? You've got eyelids, lashes, and you've got corneas, you've got pupils, and you've got retina. So this part of your eyes, for you to see clearly, your eyes must be healthy. You don't have any swelling, you don't have any red eye, you don't have any pain. Has anybody ever experienced pain in their eye? I need to see your comments. If you've ever had something that said, oh, I feel like there's sand in my eye. I feel like my eyes are itching. I feel I have a headache. These are things, we call them symptoms, which means if your eyes are not healthy, if your eyes are not focusing properly, if your eyes are red, if your eyes are in pain, there is a problem. So it's my duty to tell you now, have you been to an optician before? Most people think opticians are there to just give glasses. But our duties as an optician is not just to give you glasses. is to also link your general health to the functionality of or your eye visual performance. So if you came to me, for instance, as an optometrist, the first question I'm going to ask you, or one of the questions I'm going to ask you is, why did you come to see me? I want to know why. And I probably will hear you saying to me, oh, I've got headaches. Oh, I've got double vision. I've been getting headaches. I cannot read my book clearly. I cannot see far. I cannot see near. Or you might even tell me, I woke up and I noticed some spider webs. Or I woke up, I noticed flashing lights. Who have ever experienced any of those things? I need some comments if you have. I'm reading your comments. Or probably you feel gritty sensations in your eye. These are common complaints we get. But if you've ever fallen into such categories, that's why I'm having this talk. But most excitedly, your eyes are not just for glasses. Yes, Unique Modality said flashing lights. Your eyes are not just about glasses alone. Your eyes are for checking the health of your eyes. Do you know that from your eyes I can pick up if you've got blood pressure problems? Do you know I can pick up if you've got diabetes? And do you know I can pick up if you've got cancer in your eye? Do you know you can pick up if somebody's got life-threatening diseases just from your eye test? So it's not really all about glasses. Tonight is for me to let you know that there is more to the eye than just seeing. There is more to the eye than just wearing glasses. There is more to the eye than just wearing contact lenses. I just want to let you know, in case you have children. Hi, Lade. Nice to see you. Hi to see you. Nice to see you, MG Goldstar. Your eyes are important instrument. You cannot replace your eye with goat eyes, you know. Neither can you replace it with chicken eyes or pig's eyes. So I'm just here to tell you that it's time we start looking after our eyes. It's time we start thinking again and telling ourselves, I don't want to go blind. I don't want my eyes to be sick. I want to have healthy eyes. Now, what are the things that can make you go blind? You probably will ask. Did you know if your blood pressure is too high, it can literally cause an explosion at the back of your eyes? Did you know that? And oftentimes, you may not have symptoms. Hi, Dr. Baliwan. Did you know that if you're diabetic, before the diabetologist notices it, that you could have what they call retinopathy of the eye, which is a bleeding in your eye? Did you know that? Did you know that we can pick up strokes from just looking at the back of your eyes? And if you do have children, just to let you know, several kids have been diagnosed with autism, been diagnosed with having difficulty understanding, merely because their moms and their dads never took them for an eye test when they were younger. Did you know that kids can have crossed eyes? You know what they call crossed eyes? You know, where their eyes are looking to the left and one looking to the south. Probably in another talk we'll talk about that. But did you know that kids can have lazy eye? And this lazy eye could have been rescued if you took that child to an optometrist when they were younger, when they were about 5 or 6 years old. Yes, 5, 6 years old. Because there are markers we have in children when they are so young. Did you know that? There is a particular story in England. The first time we had a lawsuit against an optometrist who missed something in a child's eye and the child died. The child had what is called papilledema, a swelling of the optic nerve. So when your child is saying, I have a headache, it's not because she's asking for chocolate. Get the eye tested. It could be life-threatening. This child was tested by a GP, came to the hospital, they missed it, and the child died. That child could have been saved. I've seen cases where people came to see us and within days they died. So your eyes are important. Your eyes are key. Your eyes is not about glasses. I know several people hate glasses. I hate glasses myself. But guess what? You can't have a replacement. You can't have a replacement. So it's important we visit the optician. I'm going to mention a few things that can cause problems in your eyes. I have mentioned dry eyes. There are things called glaucoma. I'm so excited about glaucoma. The reason I am excited about glaucoma is not because of the fatality of glaucoma, but because it's a preventable problem if it's picked up early. But do you know if you're somebody of the black ethnicity, you have a high risk of losing your sight from glaucoma? Now, yeah, I'm not being racist, but I'll tell you the truth. If you're black, if you're 40 and above, if you're even aging, you can have glaucoma. And what is glaucoma? Glaucoma is the optic nerve damage associated with your visual field damage with increased pressure as a risk factor. I know, big words, big words. Now, what it means, when I use light to shine on the back of your eyes, and I will notice what is called the optic nerve, which is connected to the brain, is damaged, and I notice that you cannot see your periphery very well, with increased pressure of your eye, you have got glaucoma. So age is a risk factor. Being black is a risk factor. Being an Asian is a risk factor. Even being a Caucasian is a risk factor. But the interesting thing about glaucoma is it doesn't often give you symptoms. You might wake up one day, or somebody may wake up one day and find out, oops, I can't see. But you can't find out because you haven't had an eye test. You might wake up sometime and find out your child can't see. Your child can't see because you didn't take the child to the eye clinics. Do you know that glaucoma can be picked up early? Because one of the risk factors also is family history of glaucoma. So it means you can ask your dad, ask your brother, ask your mom, do you have glaucoma? Have you been tested to have glaucoma? Why? It causes blindness. There is no two ways to say it. There's no, let's pretend about it. Glaucoma causes blindness. I can't say it enough. So if you haven't had an eye test and you're brown skin like me, or you're Asian, or you're Caucasian, you don't know you have it because it doesn't come with any symptoms, except when it's what is called narrow angles and it comes with pain. So when you come to see me, I will do what they call a visual field test. I will check your pressure to make sure it's not high, because you can have what they call normal tension glaucoma, or you can have open angle, closed angle. You can have all sorts. You can have glaucoma secondary to diabetes, secondary to blood pressure, secondary to trauma, all sorts. But you won't know because pressure sometimes don't give symptoms out. Then you have things like cataract. Who's heard about cataract? Who has heard about cataract? Cataract is literally a blockage of light between the anterior chamber and the posterior chamber of the eye, making it impossible for light to come across to the back of your eyes. Sometimes we think cataract is only for old people, but I've got news for you. Cataracts can occur in children as well. So some people give birth to children and they find out that they haven't got cataract, their babies can't see. But the risky thing about children's cataract, it could also pose as a cancer, something called retinoblastoma. So if you have a friend or a child, especially in our nations in Africa, who notice the child has white eye, please, you need to see a specialist. Do not go to people who would knock it out, because you might kill your baby. Cataract in children could be a death sentence because it looks like cataract, but it could be an eye cancer. I'm going to quickly zoom on. If you pardon me, I wrote something and I asked myself a few questions. And I said, what do you complain when you get to the optician? I made a list. I said, if you have a pain around your eyes, see your optometrist. If you have redness you can't explain, come and see me. If you have itchy and dry eye, come and see me. If you have watery and discharging eye, I need to see you. If you notice you're having double vision, I need to see you. Headaches, eye strain, especially now we use computer every day. We're on Zoom every day. We're working from home. You strain your eyes. Your eyes are not meant to be used and they get tired. Something is wrong. Then I asked myself, why do you need to see me? I wrote down 7 points why you need to see me. You know, my job is being an optometrist, but I'm an illuminator. So being an illuminator means I help you change your perspective and I help you change your paradigm. Some of the sicknesses you go through are not things that just happen because you're sick. They could be mindset issues. So I asked myself, why do you need to see Dr. Chi Vision? Why? One, there are diseases that cause recoverable and irrecoverable blindness. Recoverable blindness could be glasses. You need corrective errors and I need to correct you. So they are recoverable. But the irrecoverable ones, it's too late if you don't come and see me on time. Things like glaucoma, things that you cannot explain, sudden change in your vision. Visual field defect, they don't tell you that they're happening until it happens. So you need to see me. Raised eye pressure, no symptoms. Suddenly you get a stroke in your eye. You need to see me because it will destroy your optic nerve. Why do you need to come and see me? There are some eye problems that lead to permanent blindness. You could have retinal detachment. You could have papillodemas. You could have swelling optic nerve. Those you cannot take. Believe me, you go to some place and, I'll give you tablets. No. Don't take tablets. It won't solve it. You need to see me. There are eye problems that cause death. Death. Quick going to heaven. Yes, I told you one. The little child who had a brain tumor that was missed. But if they came on time, that child will still be alive now. So please, don't take your eyes for granted. Then, life-changing diseases like diabetic retinopathies, like strokes. These are life-changing diseases. That if you came to see me on time when you have high cholesterol, we could have saved it. We have things like arthritic problems, even arthritis. Arthritis, rheumatoid arthritis can affect your eyes. Some tablets they give you in the hospitals, like methotrexate, can affect your eyes. Some tablets like diclofenac can cause dryness. Some eye drops, hair fever tablets can cause dryness. So let me tell you, it's not enough for you to just pop pills and say it will solve your problem. It could exacerbate your problems. It could make things work. MG Coaster says, my son who is almost 5, he's got issues with his eyes. Wow. When he wakes up, it takes him long. Yes. I mean, you can log on to my link tree and we can have a conversation. Thank you. So somehow, I'm a signpost. I'm a trained optometrist, but sometimes I'm not. I work within my competence. So there are cases I may not be able to help you. If I see a bleed in your eye, for instance, and the person has never been seen by a dermatologist or by a doctor, I refer to your GP. If, for instance, you're having a swelling of your optic nerve, I direct you to a neurologist. Like MG Gold Star, your child, depending on what it is, I may have to send him to an optometrist. So I don't treat every disease because I manage within my competence. And oftentimes I might have to send you for surgery if you've got cataract. Hi, Chris Ebe. And then I might have to send you to a dietitian as well, because some of the papillodemas are due to obesity. And when you're obese, it might compress on your optic nerve and cause a swelling, causing an intracranial hypertension, swelling in the brain, and the pressure becomes high. And that could lead to blindness as well. A little story I'll tell you. I had a patient who I saw probably last year, 3 months ago precisely. She came to see me, never had an eye test before, and she was a brown girl, a brown skin girl. She was seen by a colleague first, and then I saw the child, or I saw the lady. She's not, she's in her 20s. The long and short is she was ambulanced to hospital. Why? Because of the problem she had. Thank you, Playmaker. Yes, click the link on my bio. Yes. So she was ambulanced to hospital. It was nearly a near-death challenge. So that's how important your eyes are. I'm going to zoom in on children. I said, what are the common eye diseases we find in children? I did mention children cancer, retinoblastoma, childhood cataracts, and glaucoma. Kids can have glaucoma. Children can have glaucoma. Again, you've crossed eyes, amblyopia, lazy eyes. Lazy eyes can be saved if you bring in that child before the age of 8. After the age of 8, it gets a bit tricky. Uncorrected glasses for kids are important. Otherwise, it's going to affect their performance in school. Then you have disc swelling. Erling syndrome is another one, where their words jump into each other and we need to correct with colored overlays. So why do you need to send your kids in? We don't want them to have poor performance in school. We don't want them to die either because of the certain diseases. We don't want them to go blind before their time. Now, what are the common problems adults can have? I have mentioned glaucoma. There is cataract. There is age-related macular degeneration. There are eye tumors. We can pick up things like HIV even, yeah? And then general problems like damage of the optic nerve, increased eye pressures, dry eyes, and all sorts going on. Finally, the food you eat can help you improve your eyes. So everything isn't about the glasses. Your mindset can change your health and then affect your eyes. So tonight, I just wanted to talk about eyes, an overview about your eyes. And going forward, all the things I've talked about tonight, we're going to break them down into almost like different chapters. And it will be a journey to know how can you prevent yourself from going blind? How can you prevent yourself from dying before your time? How can you prevent your child from losing their sight, from being scarred for life? Because when a child has a squint or a lazy eye that cannot be corrected, he will never forgive you. When he found that, oh, mom didn't take me to hospital on time, or dad didn't take me to clinics on time. Your food matters. Seaweeds are good for you, and some other things we'll talk about. So, if you want more, there's a link on my bio. So I'll give people time to ask me questions. If you want to come on to ask me questions, I'm happy to take questions. And I hope these have been helpful. I need your comments if you want to give me some comments, or if you want to come on to ask me questions. I'm happy to take questions. Everybody's quiet. I'm not seeing any comments. Was it helpful? Was it helpful? What causes dry eyes? Okay, I'm going to say, what are the risk factors? That's the trigger first. Age is one of them. Environmental changes, like using of the computer always, is one of it. And then insufficient tears, because we have what they call aqueous dry eyes, when you don't have enough tears. Interestingly, the tears have 3 layers. You have the water, you have the oil film, and you have the mucus layer. So when any of these are deficient, it will trigger dry eyes. And as you get older as well, probably in your 30s, in your 40s, you find out that the level, the hormonal changes, all those would also be a trigger. And then the kind of food you eat also can cause dry eyes. Medication can also cause dry eyes. So the dry eyes dry eye is quite tricky. Can not drinking enough water cause it? Not necessarily. Dry eyes sometimes could be very systemic, because if you have rheumatoid arthritis, for instance, or you have what they call Sjagren syndrome, where you have dry mouth, dry eyes, and all that, it will trigger dry eyes. So water is only just a part of yes, laser surgery, yes, thanks, yes, can also cause that, yes. If I have laser surgery, will it resolve my eye issue? It depends. It depends. Laser surgery can also cause dry eyes, Tonya. You said I'm 45 and I just started wearing glasses, but I don't like it. What else can be MG Gold Star? We might have to have a chat and I can talk you through, because when you're 45, you have what they call presbyopia, and presbyopia literally means you need, your walking distance has started changing. So, but I don't know, just literally seeing your text, whether you're short or long-sighted before you became presbyopic. If you're short-sighted like me, then we can talk about how you can resolve that problem, but we need to talk. You can call me, or you can send me a text, a link on my bio, and we can have a chat. Okay? Hi, Wizzy Speak. Hi, Real Bukola, my coach. How are you? Hello, Bishop Edoka Matsu. Yes. So dry eye is actually, believe it or not, 80-90% of people have dry eyes. I'm a dry eye sufferer myself. I'm wearing plugs. I wear punctal plugs. Okay? I've got plugs. The little holes there? I've got plugs in there. It's just to help me lubricate more of my cornea. You can't see it physically, but I do have plugs. Everybody's got pipes there and it pops out water, but I wear plugs because I'm a dry eye sufferer myself. Mine was congenital. I've always had it right from when I was a child. So a lot of people can have dry eyes, and then being pregnant. If you're pregnant, anybody pregnant among us, apart from the men, of course, you can have dry eyes. That's one of the symptoms as well. It can trigger dry eyes as well. Yes. And glasses, we do contact lens as well. And yes, those can correct. Thank you, MG Gold Star. That's fine. Yes, thank you. Okay. Nice to see you, MG Gold Star. There's a very common question people ask about cataract, whether when you have cataract, is there any other way out apart from surgery? No. Cataract is very common. when you get to a certain age. But these days, they can conduct things like femtosecond surgeries, which will only last a few seconds. Hello, Real Bukola. Thank you for coming in. So cataract is something that we can do surgeries, but one thing I always say to people about surgeries, it's got to be necessary. So it's not like tummy tuck, because you can have complications, and the complications might not come out well. So you need to come and see me or have a chat with me if you know somebody who's got cataract who is wondering if they need surgery. Thank you for that question. Any more question? Any comments? Anyone? Yeah, your eyes cannot be replaced with, I said, with chicken eyes or goat eyes. This is just an icebreaker to understand how your eyes work. Unique Commodity says, mine probably has to do with the computer. It's possible, it is possible that, yes, because we're doing a lot of computer work, a lot of VDU tasks. So that would, but what I would suggest to you is that we'll have a chat as well, because I will need to hear more about what's going on with your eyes, just in case there's a lot more going on than just the dry eyes. So any more questions? So before I finish, I just want us to come to terms that your eyes, you need to look after your eyes. You need to take care of it. You need to eat the right food. And you need to take breaks in between your computer work. And above all, don't make decisions on your own and say, no, I don't need to see an optometrist. Come and see me. Have a chat with my bio and let's talk. Because this time, you need to see well, you need to live well, and you need to eat healthy to keep your eyes going. Thank you so much for watching me. And I hope we can speak again, because I'm going to set up time so that we can talk about eyes. Thank you. Any questions before I sign off? Thank you for joining me. Bye. Thank you so much. Thank you. Thank you, Bookie. Thank you, Major Gold Star. Thank you so much. Thank you. Thank you, Unique Omodadi. Thank you, Tonya. Thank you. Thank you so much. Thank you. Thank you. Thank you. Thank you. I better play my lovely music. Oh, thank you, Uncle Lulu. Thank you so much. Thank you. Look after your eyes. Thank you so much. Thank you. Thank you, Fire Emeka. Thank you so much. Thank you. Thank you. Thank you. Have a lovely night. Thank you. Thank you. Ooh, thank you so much. Thank you for the comment. Oh, I value that. Thank you so much. Thank you. We'll talk about eyes more. We'll talk about eyes more, because everybody needs to see well, focus well, without visual field defect. Yes, thank you. Okay. I'll sign up now. Thank you so much. Until I see you again, have a lovely night. Bye-bye. Thank you.